Okay, hi, hello. Kamusta kayo? I've been gone for a while. I haven't posted anything here on YouTube. I am on Facebook, Facebook Gaming, so follow me there if you're interested in watching me play. I don't talk that much there, but you can visit if you want to hang out maybe or talk about anything. Um, I'm, I just want to update you guys about my mental health status. Uh, I don't know where to start really, but it's been a rough time since COVID started. Well, even before COVID started. So many changes have happened. And in the last 3 years, it's been both good and bad. It's a roller coaster. My health has declined, both mental and physical. It's been a challenge. My hormones have become out of balance again. My polycystic ovarian syndrome has gotten worse. I had COVID. I had been diagnosed with lumps on my chest, my breast. Um, One of them needs to be removed and they need to get monitored. My bad cholesterol is very high, and I got some minor illnesses along the way. My father also was diagnosed with bad cholesterol and high blood pressure. I mean, sorry, not high blood pressure, but diabetes, which makes me feel anxious because it's hereditary. And I know I'm next. Maybe if I don't take care of myself, I'll be next. Because my aunt and grandma has passed away because of diabetes. And my father now has it. And it makes me feel anxious because, as having polycystic ovarian syndrome, I'm at risk with high blood pressure and um, diabetes also. So, with all that, I'm kind of stressed. And oh, if you can see, my pimples has gotten worse, obviously, which made me feel more insecure about myself. And look, I just covered them up with some makeup. It's kind of clear now because I've been seeing a dermatologist and I'm taking medicine for that and also applying some topical solutions to hopefully, yeah, it's actually clear. It's just the pimple marks and scars that are left. So, going back to the topic. So, because of all my conditions and all the problems that I've been having, my health as well as my relationships, the stress I've been feeling has skyrocketed, and I'm no longer able to perform at work. I've been absent. I could not focus, and I feel anxiety. Great anxiety, even though my leads are very sensitive about how they talk to me or they approach me. I'm still very anxious, um, pressured. It's not them who pressured me, it's myself. And I know that something's wrong. And I know that something's wrong because even even outside of work, I'm no longer able to finish my chores. My clothes there are not folded. They're in a pile in the corner of my room. So imagine that. I could not even fold them and put them in a drawer or cabinet. And my house is a total mess. Total mess. There are sometimes not even able to take care of myself, eat well, or sleep well at all. Where I only eat one time a day. I only sleep less than 4 hours. 4 hours. I sleep like an hour before work. I sleep sometimes for too long, like more than 8 hours. My sleeping pattern is all messed up. And I really want to help myself because I know I'm spiraling down. If I couldn't help myself, I'm sure I lose everything. I lose everything, even myself, even this life that I have. So I accept and admit to myself that there is something wrong, right? So I try to get help. I consulted doctors to address my physical conditions. Um, I've gotten better actually. Back in June or May, April, I was feeling really weak because the changes to my sleeping patterns and my eating habits, and also a lot of things going on in my personal life I want to share, but I don't think I don't really think that I'm ready to talk about it yet. But it's about me and my partner, my the way we get along. It's kind of difficult actually because I'm living with him for 3 years now, and maybe it's a story for another time. Yes, I have really bad relationships. I admit to that. The way that I did not care that much about myself, I guess myself. I keep ignoring red flags. That's it. Don't want to talk about it, right? I just want to edit this out. Okay, edit this out. But um, getting help or talking about my problems is a really struggle for me. It's been difficult ever since I was young. I have already had problems with socializing, communicating, talking to other people. Because I was brought up in an environment where there is not much affection, not much love, not much encouragement or all this care for us as children. Actually, my to be honest, my mother and father are really good parents. They did their best to help us, but the way they brought us up is kind of different. It's mostly because of unaddressed emotional, mental health issues for both of them as well. So I know that a lot of people are not open to talking about their mental states, and that they're embarrassed and that they're feeling a little stigmatized talking about mental health. But it should be talked about. Seeking medical help from someone professional is the best thing that you can do, especially if you don't have anyone to talk to. Because, some of us don't really want to talk to other people. We feel like a burden. We feel like we're bothering people just by talking about problems. Some of us are afraid to talk about our mental status because of the fear of judgment, because we fear that we're going to be judged, or we fear that we are going to be called crazy. And people here in the Philippines should be more open minded, right? And a lot are already on the path of like getting to understand that mental health is a serious issue to be addressed. My thoughts are, yes, mental health is expensive if you get a doctor's appointment. Depending on your region, it will cost a lot. And not a lot of people can afford mental health care, the medication, the psychologist appointments. And it's actually good that there are companies out there who offer this help. So even though it is really expensive to have yourself checked, it is your investment to yourself, because if you're helping yourself get better, then your life will eventually get better soon as well. The main reason why you seek help is that you want to get better, right? So you're at the point that you're saving yourself, being courageous, being brave enough to push yourself to get out of a situation where you don't want to be, and taking a big leap by pushing yourself to something that you're afraid of. Like me, I'm afraid of getting consultations. I'm afraid of talking to new people. I'm afraid uh, of going to the doctor's office. I have great fears of going to the hospital due to previous experiences that I've had. And the hospital is not a bad place. Doctors are your friends. And I'm so lucky that I have someone to talk to, like a psychologist, where I can get help. I can talk to someone if I'm feeling down, if I need a friend, if I need to book a psychologist. But it depends on what works for you. If psychologist therapy sessions would work for you, that's good. But if you have like severe, like if you have something severe that's affecting your everyday life ever since you were young, yeah, it's better that you talk to a psychiatrist, especially if you have like suicidal ideation. I don't know how to pronounce that. Suicidal thoughts or things like that. I've been thinking of hurting myself a lot ever since I was young. I've been th- I've always had these thoughts that I wanted to take my life. I wanted to disappear whenever things don't go my way. But things will never go your way most of the time. If they do, then you're so lucky. You're so blessed. But if they don't, you're still blessed. Because you know what? You may not know that what you plan is not really what's meant for you. There are things that are meant for you that is even better. So I think for me, I need to take a break. I need to take a mental break from everything. I know that I can move on from that. It will not go away. And I know that it will not go away. These medications that I'm taking, I know that they can help a little. They can help me, but those experiences, it's done. It had done its damage. So I guess I just have to go with it. I'll have to just take my medication, take um make sure that I take them on time, make sure that I don't miss my medication and to help myself address the rest of my concerns. So I'm really happy that a lot of people reach out to me, and I'm really happy that people do understand where I'm coming from. No, it's a lot. Sometimes life is hard. Sometimes life is it's gonna give you difficulties, and most of the time you're stuck there. You're gonna get stuck there sometimes, but we have to move forward. We have to do our best to move forward, not only for ourselves but for the people we love, for our responsibilities, for our obligations. We need to still live, and eventually we'll get there. We'll get in a place of peace and happiness, and I'm sure you will. I'm sure whoever is listening to this and who's experiencing a lot of things way worse than I am. I know it's not good to, I know it's not good to be in your position. I know a lot of people out there had way much worse than I do. And I'm just hoping that you guys are still holding on, are still asking for help, getting all the best that you can do. Just don't quit. Don't ever quit. I remember the video that I've seen of people attempting to take their own lives. But when they did, and they suffered a near death experience due to it. They said that they really wanted to live, and they did not, in the middle of when they were committing what they're trying to do, they wanted to back out. And it's a good thing that they were lucky enough to live another life. This may be kind of disturbing, like a sensitive topic about taking one's life, but it's true. Not all of us can handle things. All of us have different stress levels. All of us have different ways to cope up with difficulties. And some of us can only handle so little. If you know someone who needs help, if you want to reach out to them, try your best to encourage them, help them out. If you can't, if they don't want to be helped out, still try to care for them. And be careful of what you say around these people, around us. So I guess that's it for me. I don't have really that much to say. This is just a quick update. I've taken my medicine and maybe eventually I'll be sleeping soon. So bye. Thanks for watching. Stay happy, stay healthy, don't lose hope. You know, you're beautiful, you're blessed, and you're worth it.